People with Hashimoto's often get misdiagnosed and maybe not diagnosed at all, because many times doctors will just dismiss it. Hyperthyroidism can get misdiagnosed, can get overlooked, can get ignored. So was a case report showing that a patient with a thyroid storm was actually misdiagnosed as having a panic attack just because symptoms overlapped heavily. That's pretty scary. Also wanted to bring up how Graves' therapies really haven't advanced much. And the abstract says up front, current therapies for Graves' disease primarily aim to manage hyperthyroidism through synthetic antithyroid drugs, radioiodine, or surgery. However, these approaches are often limited by their incomplete efficacy and the risk of inducing hypothyroidism. And the problem is with many medical doctors, they just don't spend enough time with the patient. They probably just spend a minute or so skimming through that, just really going through that quickly. And just quite frankly, most medical doctors aren't seeing a lot of people with hyperthyroidism. So when they have certain symptoms, that's probably not the first thing that comes into mind. So how do we reduce the risk of misdiagnosis as a Graves patient or just hyperthyroidism without an autoimmune component like toxic multinodular goiter? So the other day I got a call, or actually my wife got a call from her friends, and she spoke with a friend, and I'm friends with the wife's husband. And so she said that her husband got pretty much all she said is that he was diagnosed with elevated TPO antibodies, like high TPO antibodies. And she wasn't sure what TPO antibodies were and wanted to know if I could explain it to them. The doctor really did some blood testing, and so all I really knew at that time, or at that point in time, was that the husband got the TPO antibodies, and I think they were 135, something like that. I actually didn't even look at the report. Like, they didn't send me the report. They just wanted to talk to me. And so I ended up speaking with the husband. And when I think about elevated TPO antibodies, I mean, it could be, I mean, a lot of people with hyperthyroidism have elevated TPO antibodies, but usually if that's the only thing they're mentioning, I'm thinking more hypo. So I'm thinking, well, my friend probably had elevated TSH, and then they did the TPO antibodies and then found that the TPO antibodies were elevated. And so he probably has Hashimoto's. And so anyway, I was speaking with him, and he mentioned, like, one of the first things he mentioned is that he was diagnosed with hyperthyroidism. And at first I wasn't sure he said hyper, because I mean, if you say it fast, hyper and hypo kind of sound the same. So I just repeated. I'm like, so did you say hyperthyroidism? And he said, yes, hyperthyroidism. And he was mentioning that he was fatigued, and that he knows fatigue, like, I guess from his research or what the doctor told him, that fatigue is more common with hypothyroidism, low thyroid. But he's had a lot of fatigue, not losing weight. But essentially, he went to his primary care doctor, and his primary care doctor ran some blood tests, and so that it was hyper. But what I wanted to bring up is that he also mentioned that he had blood tests about a year ago, and those blood tests apparently also show that he was hyper, but they dismissed it. They because the medical doctor told that he currently just saw that he just recently saw mentioned that yeah, it looks like your last numbers also are hyper, but for whatever reason they didn't do anything. So again, I figured I'd bring up another talk about another episode focusing on hyperthyroidism, just because I mean, with Hashimoto's, it definitely does get misdiagnosed. And I mean, someone could have fatigue and weight gain, and maybe they do a TSH, and the TSH is within the range, the lab range, but not optimal. It's higher than it should be, higher than optimal range. So I mean, without question, people with Hashimoto's often get misdiagnosed, or again, maybe not diagnosed at all, because many times doctors will just dismiss it and will run the TSH. And again, TSH might be like 3.5, which is within the lab range. So I can't really say it's misdiagnosed, because that's the ranges they use, but it just gets ignored essentially for many years until the TSH gets to the point where it's out of range, or the person goes to another practitioner, maybe even a functional medicine practitioner. But anyway, this my friend, he went to just a primary care doctor, so he didn't get the Graves antibodies. And so he has another appointment in a couple of months, not until January of 2026. I'm recording this in mid-October of 2025, and so this probably won't be released for a little bit. But anyway, so he's waiting a couple of months to get the blood test, and then he has his follow-up appointment in January. And yeah, anyway, so it sounds like he's on the antithyroid medication. I asked him methimazole or tapazole, and he wasn't sure. So, and he was kind of out and about. So, but that's what I'm thinking he was on, and we'll see. I told him he probably has Graves, just because if he had it last year, I mean, something like subacute thyroiditis will disappear. I mean, it could be Hashimotoxicosis. I mean, that's a possibility as well. But and he hasn't had a thyroid ultrasound. He hasn't seen an endocrinologist yet. So anyway, the point is that Graves can get misdiagnosed, hyperthyroidism can get misdiagnosed, can get overlooked, can get ignored. And just wanted to bring up a few situations here. So one situation, one case study. So there's was a case report showing that a patient with a thyroid storm was actually misdiagnosed as having a panic attack just because symptoms overlapped heavily. So yeah, that's pretty scary if someone goes to the emergency room and they're presenting with a thyroid storm, but then they're just told they had a panic attack. So this is an extreme situation. I would imagine most of the time a person who's experiencing a thyroid storm won't just be told that they have a panic attack. But then there's another study showing that so the background Graves' disease is characterized by hyperthyroidism, and its symptoms often overlap with those of panic disorder, which may make it difficult to distinguish between the two conditions. In this report, we describe how proper diagnosis of thyroid disease in patients with mental illness can lead to appropriate treatment. And they encountered a 34-year-old woman. And again, thyroid crisis from Graves' disease was misdiagnosed as a panic attack. And so the patient was being managed as a case of panic disorder and bipolar disorder in a psychiatric outpatient setting. And about 6 months before the presentation, she had lost about 16 kilograms in weight. And a month before presentation, she developed several unpleasant symptoms as her condition worsened. And then several weeks before, she had severe palpitations, tachycardia, discomfort in her throat. And she visited the emergency outpatient department on a Sunday morning, presenting with nausea, severe tachycardia, so really high elevated heart rate, fever, restlessness with anxiety. And we treated her as panic disorder with fever, but then noticed proptosis, so like the eyes, bulging of the eyes, and then considered the possibility of Graves' disease. And thyroid function tests were performed, even though data from her clinic was not available because it was a weekend. So if it was in this situation, if it wasn't for the woman's eyes being suspicious, who knows? She might have been dismissed and just again labeled as just having a panic disorder. But yeah, really scary. Again, I can't say this happens a lot, but I have had patients I've worked with hyperthyroidism who have been to multiple practitioners. I mean, on average, I would say hyperthyroidism and Graves' disease does get diagnosed a lot quicker than hypothyroidism and Hashimoto's, but there definitely are exceptions, definitely people who get the runaround and have to go to multiple doctors. And also wanted to bring up this other one from March of 2025 that just talking about how Graves therapies really haven't advanced much. And the abstract says up front, current therapies for Graves' disease primarily aim to manage hyperthyroidism through synthetic antithyroid drugs, radioiodine, or surgery. However, these approaches are often limited by their incomplete efficacy and the risk of inducing hypothyroidism. And then they do talk about other potential treatments that are up and coming. Again, at least they're experimenting with. Of course, there are medications and not addressing the root causes. But again, that's another issue too. And I mean, same thing with Hashimoto's. Hashimoto's for many years, the same treatment is levothyroxine when you go to a medical doctor or endocrinologist. And it's no different with hyperthyroidism. It's typically for many years, it's been antithyroid medication, it's been radioactive iodine or thyroid surgery. And if you bring up diet and lifestyle changes to most doctors, including endocrinologists, most of them will dismiss it as not being helpful, very discouraging many patients' appointments with their endocrinologist. So, yeah, so really just a reminder that the goal of the Save My Thyroid podcast, I mean, there's a few goals. I mean, one here, we're spotting misdiagnosis stories, just teaching listeners the red flags that can often get dismissed as anxiety, panic attacks, or other symptoms. I mean, another area which I need to focus more on, under discussed populations. So I don't talk a lot about children and teenagers just because most of the people I work with are adults, but I do see some children and teenagers as well. And I have some episodes on that. And I'm not saying that should be the main focus, but probably something I do need to talk more about. I mean, just yeah, I mean, there are other populations and other things I should focus on a little bit more in this podcast. And then going over the science. So recently, I released an episode that spoke about L-carnitine and selenium in combination with methimazole. How if you take those two with methimazole, you might need less methimazole, which is always a good thing. And so that was also a recent study. So just always trying to keep up with the latest research in thyroid health, thyroid autoimmunity, and I guess now what I'd like to do is just talk about some of the this, like how do we reduce the risk of misdiagnosis as a Graves patient, as or just hyperthyroidism without an autoimmune component like toxic multinodular goiter. Well, of course, we need to know the symptoms that mimic other conditions. So again, we just gave like panic-like symptoms, anxiety. Again, sometimes it can be difficult, and we'll talk about other things you do, obviously testing, but anxiety, racing heart, tremors, sweating, again, that could be mistaken for panic attacks. Depression, fatigue, sleep issues, irritability, maybe labeled as having a mood disorder. Having weight loss and high appetite might be brushed off as having just good metabolism, or if someone's dieting, that could be a factor. I mean, when I dealt with Graves, I lost a lot of weight, had a higher appetite, increased appetite, and I was dieting. I was dieting, detoxifying. I was overtraining. So if I went into the eventually I saw a doctor because I developed the tachycardia. But if I saw a doctor sooner, they might have just said, well, hey, it's due to the weight loss, and I mean, I'm sorry, due to the dieting and exercising. That's what I thought too, because I was intentionally trying to lose weight and figured because I was restricting calories. I really wasn't doing smart things back then, but that also was why I had an increased appetite as well. You know, postpartum changes, sometimes written off as new mom stress or depression, but again, it could be like postpartum thyroiditis. And yeah, so again, we do need to pay closer attention to the person's symptoms. And the problem is with many medical doctors, they just don't spend enough time with the patient. I mean, they of course, have him fill out a comprehensive health history, or they should have him fill out a comprehensive health history. But even then, they might not, they probably just spend a minute or so skimming through that, just really going through that quickly. And just quite frankly, most medical doctors aren't seeing a lot of people with hyperthyroidism walk into their office. So when they have certain symptoms, that's probably not the first thing that comes into mind. And that's why you also need to do the appropriate lab testing. So, I mean, TSH, thyroid stimulating hormone, that's usually what doctors start off with. I mentioned the case of hypothyroidism, Hashimoto's, it's flawed in that a lot of people are above the optimal range, but within the lab range and yet dismissed. Hyperthyroidism, it's a little bit different. I mean, if someone has Graves, the TSH many times will be depressed. And if the doctors or whoever orders the test sees the depressed TSH, they should, if they haven't ordered thyroid hormones, the T4 and T3, they should order the thyroid hormones. I mean, many times they'll just do a T4, but sometimes TSH isn't completely depressed. Sometimes it takes time for that to happen. It could happen real quickly, but not always. So really you want to do a full thyroid panel. I mean, at the very least, TSH and free T4, which that's not a full thyroid panel, but not just the TSH, but yeah, you want to do TSH, free T4, free T3, look at antibodies. I mean, if you're suspecting Graves, definitely do TSI, thyroid stimulating immunoglobulins, and/or, I mean, I prefer TSI over the TRAB, the TSH receptor antibodies, but still, that's better than not testing any antibodies, or in this case, even though my friend was hyper, he just had TPO antibodies tested. And again, that's a drawback of seeing a conventional medical doctor, is that they're even less likely to see hyperthyroid patients. So many times they just default to those TPO antibodies, or sometimes do the TPO and thyroglobulin antibodies in everybody, even there in people who present with hyperthyroidism. So definitely want to do the right antibodies. I mean, if you want to do all three antibodies, nothing wrong with that, especially if someone's presenting with hyperthyroidism. And so, but again, many misdiagnoses happen because only the TSH is checked. And yeah, TSH, of course, doesn't tell the whole story. If you are looking to do everything you can to save your thyroid, in addition to watching my videos on YouTube, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid. Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and or your thyroid. There will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit savemythyroid.com/newsletter. And I mean, another thing, just be familiar with the red flag combinations. Like if you have rapid heartbeat and weight loss, again, I could understand where if you go to, let's say, your primary care doctor, they might not catch on that it's hyperthyroidism. I mean, again, that's why you want to also look at other aspects of one's health history and do the appropriate testing. But if that same person has rapid heartbeat, weight loss, and some eye changes, especially like bulging of the eyes, again, in that case, like in the case study I mentioned earlier, that was what made the people at the emergency room realize it wasn't probably just the panic disorder, but a good chance maybe it was Graves' disease. Similar, if someone is in postpartum and they're having like sudden mood swings and other symptoms, maybe the milk supply dropped. Obviously, if they're having like tachycardia, I mean, again, test the thyroid. Just do some testing. Don't assume that it's stress or mood related. I mean, if someone does a lipid panel and they see low cholesterol, which is very common with hyperthyroidism, again, not everybody, so I wouldn't rely on a lipid panel because some people have elevated cholesterol even with hyperthyroidism, but very common for people with hyperthyroidism to have low cholesterol, like less than 150, and LDL that's lower too. And most medical doctors don't pay attention to low cholesterol; they just pay attention to high cholesterol. So, like I said, I wouldn't just if you go through a physical and maybe they don't do a TSH at all, but you're feeling some of this, you're experiencing some of the symptoms I mentioned earlier, and then you have low cholesterol. Again, that I mean, you're probably going to have some of the other symptoms as well. I'm not saying just the low cholesterol would justify doing a thyroid panel, but maybe. I mean, there's a reason for the low cholesterol. Could be potentially genetic, but could be something else as well. So, and then also advocate for imaging if needed. Like when I went to an endocrinologist back in 2008, so I was already diagnosed with hyperthyroidism, referred to an endocrinologist to get where I got the official Graves' disease diagnosis. And so I mean, we could say maybe I didn't need an ultrasound because an ultrasound really is going to diagnose Graves' disease. I mean, if you're hyper and you have the TSI, positive TSI antibodies, then yeah, I mean, that's pretty much diagnostic of Graves. Or if you have hyperthyroidism and bulging eyes, then you probably have Graves. Some doctors do the radioactive iodine uptake test, which in many cases it's unnecessary, especially if the TSI is normal. I mean, I'm sorry, if the TSI is elevated and in the presence of hyperthyroidism. Now, uh, I asked for an ultrasound because I just wanted to see if I had thyroid nodules, and she palpated my neck and didn't think I did, or palpated my thyroid and didn't think I had nodules, but I still wanted that ultrasound. And that's why some will do the uptake test, is because they want to see if the nodules are cold or hot. And if they're cold, there's a greater chance of them being malignant, but still only a 5% chance. So still, yeah, I mean, it's not going to confirm the uptake test if someone has malignant nodules or not. And then also, don't be afraid to seek a second opinion, and do so sooner than later. If you're experiencing all these symptoms and they just dismiss it as anxiety, panic attack, and if you don't agree, or maybe you agree because they're the expert, but they could be wrong. So you might want to consider getting a second diagnosis. And again, an endocrinologist, I mean, They're definitely not perfect endocrinologists, especially if you're looking for a natural approach. You don't want to see an endocrinologist, but usually they do a good job of diagnosing. So, like if you go to one general practitioner, let's say, and they just say you're experiencing anxiety, panic attacks, yeah, you might want. I mean, you could go to another general practitioner. Might want to see an endocrinologist. I know it's challenging because again, they might not even bring up thyroid. So why would you go to an endocrinologist if they're not thinking thyroid and you're not thinking of thyroid? So it could be challenging, but at the very least, I mean, if you have to go to another general practitioner, then go to another general practitioner. Hope that they do the appropriate testing. And I mean, don't be afraid to offer to pay for it. If they say, well, your insurance might not pay for a thyroid panel. And again, it comes down to diagnosis codes. So if you have insurance and they're putting in the right diagnosis codes that they're suspecting that it might be, again, that's the thing about testing. You don't know if it's thyroid or not, maybe, but that's why you're doing the testing. If you knew, then you wouldn't have to do the testing. So the insurance isn't going to deny the claim because the doctor ordered a thyroid panel and then it turned out to be normal. I mean, they did it to rule it out just to make sure. So, yeah. Anyway, they shouldn't. I shouldn't say that. I shouldn't say that the insurance company won't deny because I mean they do crazy things, but again, it comes down to proper diagnosis codes and all that good stuff. And then, of course, look beyond thyroid labs and just I mentioned some other things, but I mean, symptoms are still important, even though you don't want to rely on symptoms. I mean, bone density. If you get a bone density scan and you have osteopenia, osteoporosis, it could be a lot of reasons for that, but could be hyperthyroidism. Now, it could be like maybe had hyperthyroidism in the past. I would argue that most people who have low bone density don't currently have hyperthyroidism. But again, the point is just you need to keep an open mind. You need to really work with a practitioner who's not just going to rush you in or out. And just, I mean, obviously trust your instincts as well. And then also, if you're working with a natural healthcare practitioner, of course, choose one that has experience with hyperthyroidism and Graves' disease. And it doesn't mean that has to be the main focus, like myself. It doesn't mean that's like their number one focus, but I would at least call the office. I mean, I would visit their website. I mean, if they don't have anything on the website about hyperthyroidism Graves, that's a big red flag. If they have testimonials on the website and none of the testimonials talk about how they dealt with hyperthyroidism or Graves and restore their health, that's another red flag. I mean, you could call the office, speak with you probably won't speak with the practitioner, but speak with the person, like the staff people, the front desk person, and just, I mean, ask them like, what's some of the top conditions the functional medicine practitioner works with. And if, I mean, they might say thyroid, and if they just say thyroid, I would dig deeper and say, oh, okay, well, what type of thyroid conditions? And I mean, if they say hyper and hypo, then I mean, again, I guess just see what they have to say. I mean, if they just say hypothyroidism and Hashimoto's, again, another red flag. So, but anyway, really the main purpose of this is just like the previous episode that I mentioned, is to bring more awareness. That we need to bring more awareness. I mean, that's the purpose of this podcast, obviously, and other things that I do. But yeah, just hopefully you found this to be valuable. And also wanted to bring up, I've been talking recently about my Healing Graves Naturally community, just because living with Graves' disease or other types of hyperthyroidism, you can feel incredibly lonely when dealing with these conditions. Again, you go online, you search for answers, and most of what's online is about Hashimoto's. And then, if you do see an endocrinologist, they'll typically just tell you to take antithyroid medication or to do the radioactive iodine or surgery. And nobody explains, why you have hyperthyroidism or Graves. If you have Graves, they don't really talk about what your antibodies mean, and they might only test them a single time. And yeah, so anyway, it could be really confusing, could be overwhelming, and at times it makes you feel like you're the only one going through this. And I do have a couple of Facebook groups, but the problem with the Facebook groups is that they're so large. And I mean, also, I don't trust Facebook. They could shut down my groups at any time, and they Sometimes we'll just randomly delete people's comments. Yeah, so I decided, I mean, I still have my Facebook groups, but I also created a new community specifically for Graves and hyperthyroidism that's not on Facebook. And yeah, and definitely something I recommend checking out inside. This community, of course, we focus on the answers you can't find elsewhere. I mean, it's right now it's a smaller group, and that's the goal, is to keep it small, but the engagement is really great. So yeah, I definitely would check it out. Again, the name of the group is Healing Graves Naturally. And again, number of different benefits of being part of the community. Hope beyond the standard three options recommended by endocrinologists. So not just I mean, there's a time and place for antithyroid medication. A lot of people I work with are on methimazole, PTU, carbimazole, but some are not on that. Some like myself take the natural agents like bugleweed, motherwort, higher dose of L-carnitine. So again, we talk more. We don't just focus. Obviously, the focus isn't going to be on medication, radioactive ion, or surgery. It's going to be on finding and removing triggers, healing the gut. And then obviously you're going to get guidance from someone who's been there, and myself. And I mean, it's not exactly the same. Of course, you're not working with me one on one, but still, I mean, in the Facebook groups, I'm just really, I don't want to say I'm never present. Sometimes I'll do a Q&A, a random Q&A, and I do some commenting, but I don't spend a lot of time in there, just because, again, there's tens in my hyperthyroid Facebook group. There's, as of recording this, almost 25,000 people, and it's just too big. And then if I do post something, which I do have regular posts, I still like try to engage, but they're very basic, and only a small amount of people see it, just because that's Facebook's algorithm. And so, but anyway, you'll get some support, some guidance in the group. And again, there's a lot of engagement from others in the group. And then, of course, evidence-based natural solutions as well. And yeah, and also just to let you know, the group is free. I want to help as many people as I can. Eventually, my plan is it's probably going to become a paid group, just because I want to keep it small. I mean, the goal is not to keep it like super small, but I don't want 10,000, 20,000 people in the group. Just again, I think that's really too big. At least, I mean, maybe my perspective will change. But anyway, today you can join at no cost. Plus, when you join, you'll also gain free access to my brand new Graves' disease survival roadmap training. And so just click, if you're interested, click the link in the show notes, and become part of the community that finally puts Graves and hyperthyroidism at the center of the conversation. Again, I'm sure you'll be happy that you did. And that's it. So hopefully you found this episode to be valuable. Again, just I'm going to continue to spread the word. You're going to see, I mean, there'll be like the interviews that I do I mean, those will focus on both Graves and Hashimoto's, just because most of the people I interview aren't really familiar with hyperthyroidism. But you'll see not all of the solo episodes, but more and more of the solo episodes will focus on hyperthyroidism and Graves. So hope you found this episode to be valuable. And of course, look forward to catching you in the next one.